Everyone, we're here with Vachika, and she's going to tell us a pretty interesting story. And Vachika, I met you, and you were just married, weren't you?
Yes, 3 months before.
3 months before. Well, congratulations on that.
Thanks.
And that was fairly recently, towards the end of 2011, I believe.
Yes, December.
Right. And you had started to have some abdominal type symptoms. What were they?
I just had some stomach cramps, and 2 weeks before I saw you, I had a little bleeding in my stool.
Okay. And you ended up having a colonoscopy, is that right?
Yes.
Okay.
I had on and off stomach cramps in October, and I went to see my PCP, and he told me it was part of just irritable bowel syndrome after he did a couple of tests. And then once I saw the bleeding, I decided to just go ahead and go see a gastroenterologist. And
right. How old are you, Vachika?
27.
You're 27 years old.
Yes.
You were just married 3 months ago. You had a stomach upset, basically, and you went in to get a colonoscopy.
Yes.
And what did that show?
That they took a couple of biopsies, and I had a mass, and it came back, and I was diagnosed with colon cancer.
So you were 27 years old, and you were diagnosed with colon cancer.
Yes.
Okay. And and then you came to see me as the surgeon, and we went ahead and removed that robotically, actually.
Yes.
And we got 34 lymph nodes out, and I'm so glad to say that all of them were negative, which is great news for you, and we were happy with that. We also ran you through a bunch of genetic tests, and without getting into all the details of that, they were all negative.
Yes.
The most sophisticated tests were all negative. Now, Vachika, do your parents, did they have colon cancer?
No.
Okay. Did you have uncles?
No.
Okay. Are you a smoker or a drinker?
No.
Do you eat bad? What kind of?
No, I don't eat.
Do you eat a lot of meats and red meats and that?
No, I don't eat red meat at all. I eat mostly fish and vegetables, and sometimes I have chicken, but very healthy, and I exercise regularly.
Okay. So there really wasn't any reason for you to get this, and actually it highlights the fact that most colon cancer just happens sporadically. You don't have to actually, have any risk factors, and that's one of the things that we want to kind of emphasize. Now, you are still very young to have had colon cancer, but it looks like you're pretty much cured of this, and we're just going to follow you very carefully after this. Is there a message that you can say to anybody who's having symptoms?
If you don't feel well, then you need to go see the doctor, and if they give you a diagnosis that you're not happy with, then you just keep being an advocate for yourself, because at the end of the day, it's up to you to, communicate to your doctor how you're feeling, and if it doesn't seem right, then go see another doctor.
All right, Vachika, very well said, and thank you very much for your time.